rate coming out of the hospital or the jail is 95 to 99%. Okay? Why does this happen? Let's show you some information. This is a picture of brain metabolism. This is glucose metabolism showing how hard your brain is working. The one on the left is a normal control brain, red and happy, which means the brain is functioning. The one on the right is an active cocaine addict, and their brain, it looks like they pulled the plug on the machine. Okay? And anybody who has a friend or relative who's a cocaine addict knows there isn't a whole lot of judgment and higher executive functioning going on when you're using cocaine. But here's more bad news. This study was done, the same study, the slides look a little bit different. And what they did was they took controls, and then they took people who had stopped using cocaine. So on the top, you have 3 control patients, and the red and yellow is how you're supposed to look. That's your normal level of metabolism. Then they took 3 patients who had stopped using cocaine 10 days ago. Now you can tell there's really nothing going on in that brain. It's all blue. Blue means nothing. Nothing happening. And you would say, well, okay, but it's only been 10 days. I got news for you. That's when you get out of most treatment centers nowadays, because your insurance won't pay for anything more. Okay? More bad news. The 3 on the bottom just got their 90-day chip, and look at their brains. There still is dramatic evidence of brain damage at 100 days out. By the way, if you were an impaired doctor, this is when we would let you go back to doing surgery. Is anybody here having surgery next week? Think about it, okay? And it turns out it takes about 1.5 years to recover your brain function when you stop using drugs and alcohol. So when someone gets out of treatment, gets out of Brighton Hospital after 2 weeks and drives to the bar straight from Brighton Hospital, we say, why on earth did he do that? Why would someone do that? They did it because they're brain damaged. If you had a relative who had a massive stroke, would you send them home from the hospital and say, I want you to drive home, pick up some groceries on the way home, and then go home and clean the house? No, you put them in rehab. We don't do that with addiction patients. We give them a week, and then we turn them loose. Okay, so how do you tell if you're addicted? If you go by the old criteria, which is the DSM-4, now the DSM-5 rolls this all into one. Here's the criteria for addiction. Tolerance, withdrawal, you take more than you planned on, you can't cut down, you spend all your time doing it, you give up everything for it, you use this by the physical or a psychiatric problem. If you have 3 of those in the past 12 months, then your doctor says you have addiction to whatever it is you're addicted to. But there's a better definition, and that is to describe the craving and compulsion that the addict has. Use the 4 C's. Those of you who have a relative or even yourself